and research information about autism. This series is brought to you in partnership between the Auburn Schools of Virginia and Maryland and Potomac Psychiatry. I'm Andy Hubner, the Executive Director of the Auburn Schools. The Auburn Schools are a small, intimate, independent day schools specializing in providing supports to students in areas of executive functioning, social learning, social pragmatics, and self-regulation. Although we are not diagnosis-driven, we do serve students with high-functioning autism, social pragmatic disorder, sensory processing disorder, communication challenges, ADHD, anxiety, depression, and executive dysfunction. Auburn has two campuses, one in Chantilly, Virginia, serving children K through 12, and the other campus in Silver Spring, Maryland, serving children K through 8. Please visit our website for additional information, including open houses and admissions at www.theauburnschool.org. And now it is my great pleasure to introduce Dr. Bruce Kerr, founder of Potomac Psychiatry.
Thank you very much, Andy, for the opportunity to be here and present this series along with the Auburn School. Welcome, everyone. My name is Dr. Bruce Kerr, psychiatrist and founder of Potomac Psychiatry. And thank you for joining us. At Potomac Psychiatry, we don't just treat our patients' symptoms, we uncover and treat the underlying root causes of their mental health conditions using recent advances in genetic testing, gut microbiome assessment, cellular health and immune system functioning, and other cutting-edge laboratory tests. We practice what is known as root cause psychiatry. This is our second session of our four-part virtual webinar series, where top experts in autism will be available to answer your questions. Potomac Psychiatry has pre-recorded 6 highly informative video webinars from these experts. And at the end of the session today, I'll let you know how you can view these webinars online and be able to attend the upcoming Q&A events. And now, it is my great pleasure to present my friend and colleague, Julie Wendt, who's Potomac Psychiatry's functional nutritionist. Julie is a licensed nutritionist that loves to bring awareness around the impact that our diet and lifestyle choices have on our health. She is passionate about partnering with her patients to help them implement changes that help them feel their best. She uses advanced genetic testing and other health tests, extensive health history and genomics to craft personalized treatment plans that are doable and effective. She's also an avid student of cellular biochemistry, and I think of her as our nutritional biochemist. Julie works with people of all ages and specializes in conditions related to gut health, nutritional deficiencies, and cognitive decline. She has specialized training in gut healing, the use of ketogenic diets, and Dr. Dale Bredesen's RECODE protocol to reverse and prevent Alzheimer's disease. She's part of our specialty programs here at Potomac Psychiatry, including the Autism, Root Cause Psychiatry, RECODE, and Long COVID programs. To go ahead and ask Julie a question, please left-click on the Q&A button at the bottom center of your screen and type in your question. Dominic will field your questions to Julie, and she may not get to answer all your questions this evening, but she will try to get back to you with answers in the coming weeks. Once again, thank you for joining us, and please ask away.
Thanks, Dr. Kerr, for that generous introduction. I'm very excited to be here with you all this afternoon and really looking forward to answering your questions around nutrition and autism spectrum disorder. For those of you that didn't get a chance to watch my videos yet, I just wanted to give a little 2-minute recap of the key points that was going to guide our discussion around this very important topic. The field of integrative nutrition and nutritional psychiatry really hold at their core a belief that there's this connection between the gut and the brain, and it really provides the foundation for our health and well-being. So this belief is supported by a growing body of evidence that details how a bidirectional highway called the vagus nerve allows for interaction between these two systems. So they're going to interact through messengers and metabolites produced in both locations, and really emphasize the importance of this community of microbes that inhabit your gut, as well as provide nutritional access to everything that you're eating, drinking, and taking in. So both the health of your gut microbes and the health of your cells are reliant on diet and lifestyle choices in order to find balance and optimize your health. So it's with a great honor for me to discuss how we can use these tools with your child and think about what your child is eating, what your child is not eating, to really help them feel their best. In the research, we see nutrition trends in our kids with autism spectrum disorder, along with very specific challenges around eating healthy that surpasses their neurotypical peers. So we need to pay very special attention to this population. And my goal tonight is to help provide some helpful information, maybe point you in the direction of additional resources. I think we've put a link to one of our blogs that discusses this real foundational approach of integrative nutrition and that intersection with the field of psychiatry.
Well, awesome. Thank you, Julie. Everyone, I am Dominic. I am just the manager of questions tonight. And so real quick, I see that Damien already got us warmed up with a question. But what I'm going to do right now is I'm going to put up a little quick poll so that we can make sure all of our fingers are working. And as I put up this poll here, it's going to ask a pretty simple question. Have you had a healthcare professional recommend a change to your nutritional lifestyle or to a family members before? And in here, just go ahead and click your answer. We'll share the results in a little bit and ask a follow-up question or two about it. But go ahead and show us that your fingers work and you can click away. That being said, I'm going to go ahead. We're going to start off with Damien. Thank you, Damien, for asking the first question of the night. Everyone, feel free to follow Damien's lead and ask away. So Damien says, for kiddos who have high sensory issues and chose to eat only one thing for, say, 3 months at a time, do you have any particular methods you would recommend for helping with getting good food diversity and better gut health?
Yes. This is very, very much at the heart of a lot of the challenges that we face. And I think there are some key pieces to bring in. First of all, is an assessment of the severity of the restriction and whether or not we actually need to bring in more support. We think of food choices as isolated to the meal or the table. And actually, our food behaviors and patterns are a manifestation, particularly in this population, of the difficulties that the kids can be having with communicating, with having sensitivities to texture and smells and sensory inputs. And so to a large extent, there are cases where we need, the support of a provider to help with reintroduction and, really pacing the interactions with foods in very much the same way you would with any other fear, because it can be to that extent. So I just would start by saying, let's make sure, depending on the degree of restriction, that if we need more support, we need to look at this more holistically, that you're tapping into those resources. From I guess more of a moderate perspective, something that's mild to moderate in terms of restriction, a lot can be learned about the particular restriction by trying to get very curious and making sure that we're understanding what exactly it is that's creating that universe for the child of just that one food or a handful of foods. Um, a lot of times, particularly if communication is difficult and emotions are not easily expressed, we need to ask into, depending on the age of the child, you know, is there something about this food that bothers you in particular? Does, you know, how do you like the smell, the texture, the color? Um, Thinking about what else is going on at the table when food is presented, right? So if we have sensory overload and difficulty processing external stimuli, can we improve food choices by dialing down the intensity level for them and creating a simplified environment? And once you start to dig into more of the details of why this one food has become preferred, either by yourself or with the help of a professional, then you can start to navigate in a more strategic way how expansion might look, right? So a very common one will be texture. So let's say that there's a certain texture that's palatable, and it could be driven from a physical perspective. Maybe there's a chewing issue, maybe there's a gag reflex or swallowing concern that the child is having that's really narrowed that choice. And being able to adjust foods and create other options that might be of that same texture could help expand the diet in that way. So, and it could be the same, you know, whether it's a smooth texture, so you tend towards baked foods and smoothies and, you know, things that are creamy in nature, or it could just as easily be crunchy, right? Some people really are into that texture and going more towards raw foods, and foods that have a little bit of crisp, right? So these are small things that as you learn more about where the hesitations are, you can really make a big difference in expanding and then doing so in a way that doesn't feel threatening or have any fear, but more so like, oh, you know, this, we're connecting, we're talking, and we're understanding where, you know, the friction really is, and then we're able to address it.
You know, it leads me to think about a follow-on question to that. That's a really great question, Julie. Dr. Ng, who presented last time, talked about the FRAT test, the folate receptor antibody test, which is a new test that assays a new autoimmune condition in 70% of children with autism, and then readily treated if the test is positive with leucovorin, which is a derivative of vitamin B9. And you mentioned communication, and the FRAT test followed by treatment with leucovorin does improve the child's communication ability. So, and you're a really good communicator. Could you, and sort of, you say a little more about, and your mom, right? And that's what got you into the field of nutrition. Can you say a little more about the whole communication piece of this?
Yeah. And I love how what you just said kind of highlights the multifaceted approach that really is particularly helpful for kids with autism spectrum disorder, because we can make strides that opens up possibilities by, say, in this case, supporting a nutrient deficiency created by that autoimmune process, right? So that there can then be more possibly leafy greens coming in, right? Which would be a natural source of that vitamin as well. So the thing with communication in our kids, in particular around food, is that, you know, food can be this very highly charged medium by which we judge our parenting skills, right? And so it can be a real source of friction and judgment. Everybody's got opinions about what you should be eating, what you shouldn't be eating. And it can really ratchet up the intensity of our interactions around food with our kids. And anyone who's been a parent for very long knows that your kids are going to pick up on that, right? So it's they are very keen at not just what you say, but how you say it. And they watch, right? And they pick up on tone and inflection and what do your eyes look like when you're saying this, right? So what I found helpful for myself is to try to take that pressure off and allow for a more neutral engagement around the topic, because then it can open up space for kids to actually talk more about what specifically isn't working for them for this particular food. And it is always shocking what they come up with. You, as an adult, you just cannot even like imagine, right? You can't make up what these little things, particular in these, you know, these kids are super sensitive and have this beautiful gift of seeing things that we can't, and like allowing that space for them to really communicate freely without a lot of pressure or feeling of judgment, or they're, you know, worried they'll disappoint you or disappoint grandma, right? Like this, there's so much of that that can go into it. I really felt like efforts that I would make to try to center myself, you know, before going into a meal was very, very much translated into how the rest of the meal went. So to the extent that parents are doing any kind of meditation or breath work, or, you know, making chamomile tea while you create dinner, anything that you can help kind of ground yourself, and then allow for that communication to be more open, is sort of the start of connecting with your kid and helping to find the path of least resistance towards what underneath all of this we know is this really important need to feed our kids and feed them well in order for them to feel their best.
Great,
Thank you
thanks.
so much for that response. Oh, did you have something, Dr. Kerr?
No, I was just thanking her for thoughtful reply.
Perfect, perfect. So we got a couple questions. We got a good amount of questions that are coming in. So everyone keep sending your questions in. We're going to try and get through all of these as fast as we can. Also, I am not the greatest reader of names. So forgive me if I mispronounce your name. Penina Alexander. I'm understanding that anxiety may be at play in how my kid eats. Do you ever recommend, and this is something that we'll be a little more general about, but do you ever recommend a medication to increase appetite or to bypass it? Or would you focus on the anxiety or would you focus on anxiety that would end up helping him at mealtime?
Yeah. Ooh, that's a good one. So my toolkit and my preference is going to be around supporting the anxiety from a diet and lifestyle perspective. And those might not be accessible, right, for your kid. So to the extent that we have another tool in the toolkit in terms of medication, if you feel like the anxiety is creating the issues around the food and the only tool you have available is medication, or it's part of, you know, the solution, we got to use everything we can. And a lot of times what we find is, you know, I think it's important to make sure you're working with someone who can, you know, find a good medication using the genetic testing and being specific. But allowing for more ease and less stress around the eating will open up higher nutrient availability, right? Because we're eating more foods, more diversity. We're then going to be allowing more access to all of those nutrients that are going to help your child create more balance, right? So they're going to be creating better gut microbiome health. They're going to be creating better methylation groups, which then allow them to turn genes on and off, create neurotransmitters, create our most important antioxidant called glutathione. So we can do that with medication. We can also do that with supplements. There's a lot of good research around using things like magnesium or L-theanine, lavender. You know, there's a lot of support for anxiety, and it's really a matter of what's going to work best for you as a place to start. And then, you know, as more healings can be achieved through that, you can reassess.
You know, Julie, you mentioned genetic testing, and one of the aspects of this that our child psychiatrists and Dr. Ng, our developmental behavioral pediatrician, talk about is in the presence of variants of a gene called MTHFR, different variants that can be assessed. When those variants are present, there is more anxiety. And the treatment there is actually a medical food, right? Like Enlight, which to your earlier point, if the genetic variant is present, the child gets Enlight, then the anxiety goes down because important neurotransmitters like serotonin, dopamine, norepinephrine are made in higher numbers. And you mentioned glutathione, there's more glutathione that's manufactured. It reduces brain inflammation. So independently of, let's say, prescription medications, they're also with certain genetic variants. You mentioned magnesium with the CACNA1C variant, magnesium can help. So there are a variety of ways using these supplements or medical foods to help reduce the anxiety as well.
Yeah. And I think being able to be specific and personalized is helpful. And that's where learning more about your child can help understand where the best interventions might lie, right? So
Perfect. All right. Well, we got a bunch of questions coming in. Thank you. Keep them coming. If we're not able to get to them, we will follow up through email. And so our next question comes from Summer. How about kids who become vegetarian overnight and refuse to eat something that is cooked next to meat? How do we deal with their fear of contamination, if any?
yeah, I would start with learning more about that fear and where it's coming from, because I think that's really going to help you understand how to respond. If that's, you know, if the child is not really able to communicate on why exactly that is, it just is, which is, you know, very common for kids. I think we want to balance accommodating that and, you know, the larger goal of, okay, if right now what we're doing is, you know, not having things touch and that is sufficient, then that's a place to start. If it feels extreme and there's an overall impact on the family and the ability for meal times to happen, that's where you may want to seek the advice of a provider that can help sort through more of the fear-based piece of it rather than the nutritional piece. The animal proteins can tend to be a hot button item for kids. And so there, for me, the downside of that is that they're also like one of the most nutritionally dense foods that we can eat. And so if there's at all a possibility to diffuse that and allow for that to maintain in the diet, or at least as part of what the family is eating, I think everyone is well served by that. It's very hard to eat enough plant-based foods to meet nutritional needs. So that would be my concern with allowing that to go on for an extended amount of time.
I would just add one other quick thing to that. Andy, you and I, before we got started tonight, were talking about children with PANDAS and PANS, these post-infectious autoimmune conditions. And not uncommonly among those kids, restrictive eating is a very common finding, along with OCD and other symptoms. So if some of these dramatic changes in eating behavior, where it becomes more restrictive, may have followed an infection of some kind, that's something to get worked up by a practitioner as well.
All right, great. We got more questions coming right at you, Julie. So more. And we're going to try and do our absolute best to honor everyone's time. We have a question coming in from Lisa. Suggestions or tips regarding overeating?
Okay. So for overeating, you want to think about if there is a piece of anxiety or depression that's part of that, and the use of food to kind of help try to regulate, particularly if we're overeating gluten and dairy, which are two food components that will in particular change how the brain works, because in the presence of intestinal permeability or leaky gut, which is very common in our kids with autism spectrum disorder, we're going to be passing those particular proteins through, interacting with the immune system, and really people feel an addictive quality to those foods in particular. And particularly in changing their mood. And so if anxiety or depression is part of it, and they start to realize, when I'm eating this, I feel better, we want to think about not just, okay, we're going to take those foods away, but also like, let's deal with that underlying, both the underlying GI dysregulation, leaky gut, and some therapy around the source of that anxiety or depression. And as we've already discussed, is there nutritional deficiencies that could maybe help with those moods as well. So that's one thing that comes to mind. And then I would say there's a lot there in terms of assuming a varied diet. What is helpful is to start with higher fiber foods, because that triggers our natural satiety hormones to start kicking in. Also bitters. So to the extent that you've got a kid out there that's willing to eat arugula, which I do have some patients that will, and that's a bitter food that can help really start that signaling that says, hey, you're eating, you're going to get full soon. Taking some deep breaths before some will help optimize digestion and optimize that process as well, getting into rest and digest mode. And thinking about the portion size and the plate. So there's really interesting research around what we see and how we internalize whether or not we're full. And that is very fickle. It's not based on any assessment of calories that our brain is doing on the fly. It very much is, if you get a giant plate out and you fill it with a portion of food that's, say half the plate, you're going to feel like you have been, deprived. You take the same amount of food and you put it on a small plate and the plate looks mostly full, the way our brain interprets that is that, we've had a complete meal. So we can use things like the size of our plates and the size of our glasses, size and shape of glasses, to really help moderate intake, because for a lot of people that self moderation process isn't working great. So what I would do is try to avoid any kind of feeling of, diet or any shame around that, because it's not helpful, and usually it just it can make things get a little worse. So
Julie, does protein, by not causing such an insulin spike, does that help in any way by having the child potentially eat protein first in the meal?
yeah, behind fiber, I would say. So sequencing with fiber, protein can help with those satiety hormones.
So simple carbs last, and no processed foods if you can help it. Is that it?
Yes, the processed foods are highly palatable. They're designed that way. These companies have spent oodles of money to know exactly how to make it so that we overeat. So that's kind of like an unfair request, is to, not overeat the processed foods. That's hard for everybody.
Well, we're gonna keep going with some questions. So we got them flying in here. So here we have kind of a little bit of a case study for us here. So, hello, how do we help our 16-year-old son, who tends to only eat in the late evening hours? He can go until 5 p.m. without eating anything, then only eats his main calories after we are asleep. We think this is intersecting with depression, but he's developing reflux as a result. So a more general question is how to get kids to eat regular meals during regular hours when, if they get overwhelmed and they don't want to eat anything at all.
Mhm. Yeah. And also to sort of think about if there's medication that might be contributing to that. That's sometimes a side effect. And so you do see kids that really don't get hungry until the medication wears off in the evening. So if that's part of the equation, you might want to talk to your prescribing doc about that to see if there's something that can be helpful. Okay, so we want to think about, your body is very much attuned to rhythm. And part of what makes us hungry is just the fact that we typically eat at a certain time. So one strategy that I would recommend starting with is creating a bit of a rhythm and a schedule by which the body can start acclimating to, okay, it's 8 o'clock, this is when we have breakfast. And it does, to start with, it doesn't necessarily have to be a big meal, but just on the weekend would be a time to start when you have a little more space to work with. Try to create a schedule where you're sitting down, there's a meal, everybody's there to the extent possible, and kind of give the cues that it's time to eat. That will help establish that more natural rhythm that the body really looks to. If you're used to eating at 6 o'clock at night, that's when you get hungry. So we want to see if we can reverse engineer some natural hunger signals, and thinking about the ability to shift into this mode that's more naturally driven by the light cues, right? So getting your son out into the sunlight, a quick walk the dog kind of request, or just sit and have a cup of coffee or tea in the morning and get some light on his face. That will help start his natural circadian rhythm that then flows and follows with the eating cycle as well. So I would start there and allow that to help shift. And when you're trying to get someone to kind of get into a schedule and they're not naturally hungry, liquids tend to be better. So start with a little smoothie, or even, you know, some water with collagen peptides in it, you know, that gives a little bit of flavor, a little bit of protein, just to start that process off.
Thank you for that answer, Julie. I think that helps me. And so, interestingly enough, Miguel asked a pretty good question here. And I think I'm going to help him out a little bit, though. He says, any suggestions on any types of food to avoid? And I would add on to that question just a little bit. If you could just make it 3 foods that if you could just wipe off the planet, what would they be?
Ooh, okay. Immediately it's going to be soda, top of the list, for various reasons. And the second, is it have to be a food, or can be it like a food?
It could be a thing inside food. Yeah.
Food inside. Okay. The second thing, particularly in this population, I would vote off the island the additives and flavorings and colors and such. So red dye 40, anything with words that you can't pronounce or recognize, those are particularly unhelpful. And the third thing, I would say overall, refined sugar, which is not a very creative response, but I can't really get around it. So the impact that this has on your blood sugar, inflammation levels, immune system, GI tract, it's all no good on top of an environment that's already challenged in many of those same ways. So the sugars that you'll find in, you know, pastries and muffins and you know, outright desserts, and Gatorades and such, right? So that all of that is really just putting fuel on the fire of inflammation that we're actively really trying to reduce. So it's a key therapeutic target for this population, is reducing inflammation.
Great answer, Julie. Great answer. We're going to take this one as the last question here. Any of the questions that we did not answer, we will answer in email form. But also after this question, we're going to walk into the poll real quick and just read those results. So Damien asked the last question here. The last question about contamination triggers a thought about the role of anxiety. We see a constant interplay between anxiety, OCD, autism, ADHD, and outcomes of single food choices, packaged foods, and excessive sugar desire. What recommendations do you have with anxiety control and food diversity exposure?
Meaning, how would I recommend addressing anxiety to help expand food choices? Do I understand it right?
Yeah, I think the question is summed up in this sentence by saying, what recommendations do you have with anxiety and control, and then food diversity exposure related to that?
Mm-hmm. I would try to give as much control to the kid in terms of where to start with diversification. So engaging your kid in the process, and from a very neutral place, allowing them to accompany you to the store, pick out things that are interesting, and really try to be as non-judgmental as you can about whatever they come up with, right? Because if the goal is diversification, part of a diversification might include, let's say, chicken nuggets, right? That's not on the top of my list, of most wonderful things we can feed our kids, but if it diversifies, then it's a place to start. And so I really think when we're thinking about food and changing and all of this, we need to really adopt that mindset of good, better, best, meet the child where they're at, engage them to try to find that common ground of where you're getting one of your concerns addressed, which is that diversification, and they're particularly feeling like what they're concerned about matters, you know, and if those two can intersect and start the journey forward, I would start with whatever comes to mind for them and allow them to be as specific as possible.
What about, that's a really interesting question. You know, we internally talk a lot about how these diagnostic categories in kids, adolescents, or adults often overlap, and people have many different attributes of these DSM-5 categories. What about, Julie, a role in answering this sort of question for tests like, you know, a NutriVal or KBMO-Fit, a food sensitivities test, to look at whether either certain deficiencies in micronutrients are present, if so, which ones have to be addressed, whether certain foods promote inflammation, because with these complex conditions, not uncommonly, don't we see findings on those tests?
Yeah, for sure. And that's part of, you know, when we've got this complex scenario, trying to find that first place where we can pull the string and start to help provide support that then opens things up further. And so we do use functional testing that allows us to see for your particular child where they have specific unmet nutritional needs. I think we can also say that if the restriction of food is fairly severe, that there will be nutritional deficiencies, right? So if there's a restriction on colorful fruits and vegetables, it's really, really difficult to get everything you need without that. So another place to start is providing more of that micronutrient support through vitamins and minerals and things that can help ease up some of the underlying environment that leads to the picky or restrictive eating.
The one other thing I'll point out is, and you and I talk about this a lot, the role of the gut microbiome and leaky gut syndrome, that those 39 trillion microbes living in our guts, if they're not healthy and getting along well and helping one another, and we develop gut permeability, that can result in a lot of these symptoms. And that microbiome can begin to change, isn't it, within 24 to 48 hours based upon what the person is eating. So that can, depending upon, again, what food is taken in, pretty rapid changes in the gut microbiome. And Rob Knight, Dr. Knight, will be our speaker coming up in a few weeks. We'll probably get into that. But any thoughts about that and testing for that?
Yeah, so we can use stool testing to help sort out if, you know, you think about GI function, there's various reasons that our gut doesn't work as designed, from, you know, maldigestion to malabsorption, dysbiosis, which is that change in the composition of your gut microbiome. So getting more specific details on how we can support that. Intestinal permeability is going to invoke inflammation in the brain through that vagus nerve connection. So that is going to activate the immune cells in our brain, the microglia, and create within that organ itself sources of inflammation that will perpetuate and stimulate further mood dysregulation, which then leads to more behavior patterns like we see with the restrictions.
Cool. Great, awesome. So I just wanted to share the results of the poll. And as you see the results of the poll, have you had a healthcare professional recommend you a change to your nutritional lifestyle or to a family members before? 2 of you said yes, and you had great results. 5 said yes, but no real results. Some said no. 10 of you said no, but interested in recommendations. And then 1 person said, no, I am happy with my current nutritional lifestyle, which is amazing. And so if anyone has any questions about any of that, about one, maybe how to stick to a nutritional lifestyle that's been recommended for you, or maybe is there a better one for me or a loved one in my life, feel free to reach out to any one of us. Everyone here has my email. You can reach out to me directly at Dominic.Fabrizio at Potomac Psychiatry. With that being said, I want to honor everyone's time and open it for closing remarks.
Thank you, Julie. Wonderful presentation, comprehensive and thoughtful replies. I'm sure we've all learned a lot this evening. For those of you in attendance who may have arrived late, this evening's presentation is being recorded, and tomorrow everyone will receive an email announcement regarding our 2 remaining Q&A events and how you can sign up for them and view all 6 of our pre-recorded webinars and Q&A from our top experts in autism. If you really can't wait for that email, Julie's 2 webinars, the first, Nourishing the Child with Autism, and the second, Eating Patterns in Autism Spectrum Disorder, can be viewed on our website, which is at PotomacPsychiatry.com. Just click on our resources link at the top of any page, and then select videos, and you'll go to the page where Julie's videos are present. Thanks once again for attending. Please feel comfortable that we'll answer your questions over the next week or 2 for those that weren't answered. We hope to see you at our next event. Have a good evening.